Hello and welcome. The number of COVID-19 cases continue to rise across India as well as in cities like Mumbai, where now we're looking at over 80,000 cases and the number of deaths are also continuing to rise. The larger question, of course, is that what is the state of preparedness and the relative preparedness of the public health and medical system and our understanding of this disease as it has progressed and spread in the last 3 months that we've seen it evolve in India as well as the rest of the world. So Mumbai specifically has continued to face this challenge, but has also been responding with additional public health capacity, both in terms of COVID-19 centers as well as overall hospital capacity. So let's get a sense on where we are today, the kind of trends that we're seeing in the progression of the disease, and how our specialists and doctors at the front lines are beginning to better understand and get a grip of this. To discuss this, I'm joined by two specialists, Dr. Tanu Singhal, consultant Pediatrics and Infectious Diseases at the Kokilaben Dhirubhai Ambani Hospital, and Dr. Harish Chafle, consultant Intensivist and chest physician at Global Hospital in Mumbai. Thank you both for joining me. Dr. Singhal, let me begin with you. The last time I spoke to you, we spoke about cases that were still emerging, including unusual ones like the Kawasaki disease, which is seen more in children. But overall, what are the changes that you've seen, and what are the new trends that you're seeing, particularly in the last 1 month as compared to, let's say, the early middle to early March to early April, when we were first getting a sense on how this disease was progressing?
So one thing is that we are seeing atypical manifestations now. We are recognizing them more. For example, we are seeing adults coming in with strokes, basically paralytic attacks, and then they are basically, when they don't have any risk factors for stroke, and young people getting fatal strokes. So that is one thing which we are seeing now. We are seeing more gastrointestinal manifestations, like patients coming in with diarrhea, vomiting, and turning out to be COVID positive. Then we are seeing neurological complications also. So patients coming in with a confusional state for which no other explanation is found. And then in children continue to be less affected. So, even now we are hardly seeing children with severe disease. So that remains the same. But, we had earlier spoken about this Kawasaki-like disease in children, which was being seen in other countries like France, Italy, UK and the US. And we have seen a couple of cases in Mumbai now as well, of children coming in with high fever, rash and low blood pressures and deteriorating very fast. So we've seen a couple of cases.
Right. So you talked about neurological conditions. Now, is that, is this triggered by COVID, or is it that these patients have contracted COVID because obviously it's now in all over in the community?
No. So we do have patients who have pre-existing neurological problems who are coming with COVID as well. But we have people coming in with neurological manifestations for which there is no other explanation apart from COVID. So we had, for example, a young woman coming in with seizures, status epilepticus, and we couldn't find any other cause except COVID. So those are the things which we are seeing. We are seeing people who have previous neurological problems but who have come with changes in their mentation for which there is no other cause. So that is being recognized. We are seeing a lot of patients coming in with, a lot of loss of sense of taste and smell. So earlier we wouldn't see it commonly, but now we have people coming that we have lost the sense of taste and smell, and that's how you recognize that they had COVID earlier. And another thing which we are seeing is a lot of body ache and myalgia. So patients even who have mild COVID and they have recovered and gone home, they say for 2 weeks they are not able to get back to work because they have such severe body ache. So I think these are some of the other things which we are seeing.
Right. Dr. Chafle, I think one of the points that I was reading you mentioned was that while the number of cases are obviously rising, but the average length of stay of patients in hospitals has come down. Could you take us through how this is happening and also why this is happening?
Yeah. So as we are seeing COVID-19 in Mumbai, particularly from say last week of March till now, over a period of 3 months, this disease has progressed. And our understanding also for the disease has changed day by day. We are receiving guidelines for management of disease as well as discharge policy are being reframed reframe day by day, depending on the condition of the patient as well as how the disease is progressing in the community. So I think because of our more stringent discharge policies, better understanding of the disease, the patient presenting to us earlier so that we can treat them. Also, the antiviral drugs that are available now, remdesivir and the interleukin-6 blocker, tocilizumab is also available. So use of all these things has, we are able to better control the disease. I think that's how the length of stay has gone down from to around say 7 days in global hospital, and also at other ICUs and other hospitals also I think it is the same.
Right. So you're saying that so while these are not cures, but these are definitely helping solve or maybe, I don't know, is cure the right word first of all? I mean,
no, actually,
because technically there is no cure.
Yeah. So actually the patients are not becoming that unwell because we are able to hold on with these drugs basically, and we are able to hold on the storm, interleukin storm and other things basically, which is so initial viremic phase and then the immunity response of the patient. So when we use this drugs judiciously at proper timing basically in the disease process, that's how the patients are not becoming more sick and they are going home earlier. That is what I'm saying.
Right. So, when we started doing these interviews in the beginning, I mean, we were mostly focusing on pulmonological symptoms and, trying to understand, the connection with obviously the respiratory tract and so on. So how has that changed, Dr. Chafle? I mean, as someone who's obviously focused on that specialization?
Yeah. So, initially, definitely, the predominant symptoms were upper respiratory illness like fever, sore throat, cough, so all these symptoms were very common. But as the disease has progressed, I think the virus is changing its antigenicity, the virulence power of the virus is changing. So the involvement in other system is happening, which is in a milder form. So if somebody has a loss of taste or loss of smell, or just as myalgia as a presenting symptom, they are not that sick. Or somebody who's having just loose motions as a presenting symptoms are not that much sick basically. So so right. The virus is progressing in this form basically.
Right. So you're saying that if someone, for patients who are turning up with these kinds of symptoms, it's very unlikely that they will become as serious as someone who's turning up with a pulmonological symptom. Yes. Is that right?
Absolutely.
Okay. Dr. Singhal, I mean, are you also seeing similar trends?
Discharge policy of, if the person has clinically recovered, you can send them 10 days from the onset of symptoms and you don't need to do a negative test. That has really helped in saving resources and shortening hospital stay. And I also agree with Dr. Chafle that he's saying that we have more options now. And we know better when to use them. So while we had these drugs like steroids and tocilizumab even 2 to 3 months earlier, we were not so adept at using them. So now we are more used to using these drugs, and I feel remdesivir has made some difference because we have started using it in our practice for the past couple of weeks, and we are having less number of ventilated patients as compared to earlier. So in all that, I agree with what has been said. However, we have seen people who have had atypical manifestations who have also progressed very rapidly. So we've had people with neurological complaints who have worsened. We've had people who have presented with cardiac problems, sudden onset myocarditis, who have had a bad time. And there have been a couple of patients who have come with gastrointestinal manifestations who have later gone on to develop respiratory symptoms. So, whatever be the manifestation, we do try and keep a close watch on these patients because they can deteriorate later. And something else which we are seeing now is because of this policy of uniform swabbing of all patients admitted to a hospital. At the time of admission, we are seeing many people who have come with other illnesses who test COVID positive. And somehow we can't connect the COVID to their other illness. They may have had a fracture and they're COVID positive. They had a road traffic accident and they are COVID positive. So that just tells us that the asymptomatic infection in the population is also gone up tremendously.
Right. And Dr. Chafle, what's your, in terms of bed management, how are you seeing the pressure today in terms of allocation of beds for general wards, COVID patients, critical care, and so on?
Yeah, so actually initially when this all the pandemic started in India basically, so we were taking patients directly. Now I think the norms have changed. the patients are being taken through the hospital through a war room that the patient has to call and tell their symptoms, and that is how it is getting streamlined. Initially, all the private hospitals were admitting patients on their own, but now, as the government has decided for 80-20 policy, 80% of patients are coming from government hospitals and from the war rooms directly, and 20% are the direct intake of them. So I think streamline of admission process has also helped in taking the patients, and triage of the patient done earlier in the accident and emergency department is also helping us know which patient should go where, and that is how the admission process is getting streamlined.
Right, but to come back to the average length of stay, when you've said that it has come down to 7 days from 14, that I'm assuming that's made a fairly dramatic difference in overall availability of beds.
That's how the bed availability has become easier, basically. The length of the stay becomes less. There is more turnover of the patients. The patient gets discharged. We can take newer patients. And as Dr. Tanu rightly said, government has helped us all by removing the clause that the retesting is required for a certain group of individuals. So all in all, if 10 to 11 days of symptoms, 7 days the length of stay, and the patient is asymptomatic for 3 days or 4 days, then we can send them home without a repeat swab. So that has also helped in managing the beds properly.
Right. Okay. Dr. Singhal, can I come to mortality? I mean, amongst the cases where we've seen or you've seen mortality, what are the broad findings and understandings?
So I would say that if in our hospital, at least, if you have patients with severe COVID, the mortality is between 25 to 30%. Okay. And one of the reasons for this high mortality is that many relatives give a do not escalate care. Because many people who are afflicted with COVID, severe COVID, are elderly, they have other comorbidities. So many times the relatives take this decision of, not escalating care further. So that also contributes to mortality. But generally, we have seen mortality in patients who are elderly, who have other problems. Kidney disease has emerged as a very big risk factor. So, dialysis patients that are at higher risk for getting COVID, and if they get COVID, then they have a bad time. You can't give them drugs like remdesivir, and many of them die. So, elderly people, those on dialysis, especially post-transplant patients, we've lost 3 or 4 post liver and renal transplant patients. We had a patient with thalassemia major who passed away. So all in all, I would say is that the chance of a person who is less than 50 years of age and who is otherwise healthy and not overweight dying from COVID is very, very low. We may have just had a couple of deaths in this segment.
Right, and you said that relatives are not escalating care. Do you mean keeping that patient in intensive care for a longer period?
No, I mean the patient cannot leave the intensive care unit because he's COVID positive, but they say, okay, do not intubate this patient. If this patient deteriorates, don't intubate. Don't use a lot of drugs like tocilizumab or remdesivir, etc. Just give them supportive care so that, the other thing which we are seeing is now that we are seeing a cohort of patients who have been long stay patients in the ICU. So earlier, you would either have dead patients or they would recover. Now you have these patients who have remained in the ICU for 3 to 4 weeks and they are having complete different set of problems. That, they have infections and they have fibrosis in the lung. They are difficult to take off the ventilator. And we are now seeing readmissions, patients discharged with COVID, who are now coming back because of other problems. Because we must understand that COVID does not leave your body pristine. Once you get COVID and even if you recover, your lungs are damaged, they get fibrosed. So many patients come back after a couple of weeks with either new infections or worsening saturation. So that we are also now looking at that scenario.
Right, and when you say this, you're obviously talking about serious patients, as in where the disease has progressed beyond a point and therefore the chances of, some kind of resurfacing.
Yes, mostly it is seriously ill patients, but there are some patients who are moderately sick also who are coming with readmission, maybe for a urinary tract infection or a bacterial pneumonia, or they had, lung findings which were not picked up in the first admission and now have fibrosis. So yes, but mostly serious patients, but some moderate patients as well.
Right. Okay. Last question to you both. Dr. Chafle, let me come to you first. So having seen what you have so far, what are you advising? I mean, apart from the broader, let's say, suggestions about sanitizing and masks and distancing. What else would you tell patients at this point of time, or people or citizens of Mumbai at this point of time, or Mumbai, or for that matter anywhere in this country at this point of time, to be careful of, and how to keep the stay on guard?
Yeah. So actually, this disease has given a lot of bad memories to all of the population basically. So as we are all following the basic norms of hand hygiene and maintaining the social distancing, other things. In addition to that, I would advise everyone to have a proper diet, proper hydration basically, high protein diet, eat properly cooked diet basically, and remain positive from inside, because I have seen a lot of patients going into depression very soon when this illness or a single member in the family or the vicinity gets affected, and there is a chaos all around. So don't push the panic button. As we all know, this disease is not severe in all of them who are infected. There are only set group of individuals or patients who are above 60 and with comorbidities and other illnesses additionally present. They become sick. Otherwise, other patients, even if they get infected, they would become all right on their own. So keeping a moral boost from inside, a positive attitude and a good immunity from inside would definitely help all of us fight this battle.
Right, and that's a very good point. Dr. Singhal, last word. I mean, what's your advice to, having seen what you have in the last few months, to people and those who might feel that they might be coming in contact or might test positive?
So first of all is don't travel unnecessarily. Even if the lockdown is open, go out only if you need to. And second, don't be afraid to get tested. So, now there's a lot of stigma about testing, because people think that if they are sick, they are febrile, and if they get tested and it's positive, their house will be sealed, their family members will be quarantined. But that, I think, is not the right approach, especially if the person is elderly or something and they are sick. They should get tested, because the chances of the test coming positive in the early part of the illness is higher. And then if you know that you are positive, appropriate measures can be taken. So that is what I would like to tell people, that, there's nothing to be afraid of, but please don't be afraid of testing.
Right, wonderful. Thank you, Dr. Singhal and Dr. Chafle. I do wish you and your teams and colleagues all the very best as we continue our fight against this virus. Thank you very much for joining me.
Thank you.